Hey everyone, Dr. Luke Peterson here, physical therapist with the knee replacement therapist. In this episode of the Need to Know Show, we're going to discuss swelling and how long you can expect swelling to last after having knee replacement surgery. So when it comes to swelling of your knee and your leg and your ankle and foot after knee replacement surgery, of course this is very common, normal thing to happen, and the reason you get a lot of swelling in your calf and a lot of swelling into your feet and your ankle is that often the fluid that accumulates is going to travel wherever gravity takes it. So throughout your day, as you have your feet down, as you're walking or sitting or doing things, that fluid is going to travel down toward your calf, down toward your feet, down toward your ankle. So that's all very common, very normal. So how long does it typically last? Well, of course there's going to be a ton of variability. There's some people who have a knee replacement surgery and they might have very minimal swelling and it might last for a very short time, maybe a week or a couple weeks. And then there's the other end of the spectrum where people have very significant amounts of swelling and very significant intensity of swelling, and it lasts for a pretty long time. There's a lot of different factors that play a part in your swelling and the intensity of the swelling that you get after surgery or in general. Just some of those different factors are things like genetics, if you have any type of vascular or lymphatic system issues or concerns, if you have any cardiac symptoms or heart symptoms, your age, your diet, your level of activity, your weight, the chronicity of your symptoms, of your pain, of your swelling, of your stiffness. All these things are going to play a big role. So kind of the general answer, usually the answer that I hear from surgeons and other physical therapists, is you can expect there to be swelling, and it's very normal to have swelling anywhere up to 6 months to a year after having knee replacement surgery. But again, this is variable. So if you're someone your swelling lasts over a year, that's okay. That's not abnormal or unexpected necessarily. The swelling is one of those things that's not going to be, you have the swelling one day and then the next day you don't have it. It's going to fluctuate. You're going to have periods of increased swelling and you're going to have periods and days of decreased swelling. It's going to change day to day for most people. But the question you want to ask yourself is, overall, is the trend toward improvement in the swelling symptoms? So what I mean by this is it decreasing in the amount of swelling and the intensity of the swelling when you get it? Is it decreasing in how frequently you get swelling? Is it decreasing in how long it takes for that swelling to go back down? And also you want to think about how your swelling and how your knee and body responds to different activities. So for example, certain activities early on in your rehab may cause a significant amount of swelling. And then as your recovery progresses, as you get stronger, as your body heals and recovers, maybe that same activity might not produce any swelling or may produce much less swelling when you do it. So that's another trend that you want to see and look for. So usually this becomes more predictable, what activities you can do, what activities you can tolerate, how quickly it will subside and calm down as your rehab and your recovery progresses. It's one of those things that slowly gets better over time. So what can you do to help manage your swelling? I have plenty of videos about that and I'll link them up above. But compression garments, elevating, especially early on after surgery, elevating that leg up high over the heart, over the head. Icing can help. And just general mobility, general exercises. Your muscles are working as the pump that's going to pump fluid out of your legs, out of your feet, and back up to your lymphatic system and your vascular system. So just staying active, moving your feet and ankles, doing some exercises, that can be really helpful too. So I hope you found your answer to your question. Thank you very much for watching. Please be sure to hit that subscribe button if you don't already and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, rehab and recovery, frequently asked questions, and much more. As always, please be sure to leave your likes and your comments below, and I'll be sure to get back to any questions that I see. Thank you very much for watching.